The Alternative Dig Talk. Real issues, real talk.
Go to the church, though.
Tawali man, what's up?
Man, can you imagine people just dump everywhere? Someone drinks water and throws the bottle wherever.
Come on, Rogers. What else do you expect people to do with an empty bottle?
Simanya now, recorder. Do you know that plastics take at least 450 years to decompose?
What? That's a long time.
Exactly. Because plastics are made out of a lightweight and flexible material that doesn't decompose easily. And plastics everywhere in the environment cause plastic pollution.
What is plastic pollution now?
It is the accumulation of plastic waste in the environment, like bottles, polythene bags, straws. All of these contribute to plastic pollution.
I have been using them without knowing their effect.
Yeah, a lot of people have. Plastics are a danger to the ecosystem, both on land and in water.
So how can we overcome this problem? Is there something we can do?
Oh yes, we can reduce by minimizing the use of plastics, reuse by repurposing them, or recycle by collecting and processing them into new products.
Everyone wants to change the world, but no one wants to change themselves for the world.
How about we change our habits for the world?
And it starts with me and you.
This message is brought to you by Alternative Digitalk.
Hi, Rogers. Can I ask you something?
Shoot.
What does corruption mean?
Well, summarily, corruption is abuse of public power for personal gain or for the benefit of a group to which one owes allegiance. For example, when a public office is abused by an official accepting or soliciting a bribe. By the way, private people can be corrupt too, like bribing police officers to escape fines.
Okay. So exactly how does that concern me?
Well, do you pay taxes?
I guess, yeah. What does that have to do with this?
Everything. Because those taxes you pay are supposed to facilitate services you use, like water, electricity, roads construction, medicines in hospitals, name it.
Okay, that is much bigger than I thought. But it can be stopped, right?
Well, yes it can, although it may not be as easy as it sounds. And here is the reason why. Corruption roots are grounded in our country's social, political, economic, bureaucratic traditions and policies.
So, what has kept it going this long? I mean, why don't we stop it?
Well, the main reason why it has been here for so long is because institutions are weak, either as a result of poorly defined ethical standards of public service, weak administrative and financial systems, or ineffective watchdog agencies.
What can we do to stop it?
At a national level, we must focus on strengthening the independence and effectiveness of public institutions that fight corruption. At a personal level, we must commit to never giving a bribe.
I promise I'll never give a bribe.
Well, that's a great decision you have made. Me and you now have to spread this message to all our friends. If we all do our part, corruption will be no more.
This message is brought to you by Alternative Digitalk. The Alternative Dig Talk. Real issues, real talk.
Welcome back from that break. My name is Edgar Matthew Karuhanga and you're still watching Digitalk TV, and this is the Mighty Drive. Every Monday to Friday we're always here starting from 8 to 10 a.m. having a conversation with you and of course helping you make informed decisions from an informed perspective when you know what is happening in Uganda and across the globe. This morning, I'm joined by the media coordinator for the Global Health Advocacy Incubator. His name is Onyum Charles Okao, and of course we are continuing with the conversation that we started earlier this morning of the civil registration and vital statistics in Uganda. You're most welcome, Onyum.
Thank you, Matthew, and thank you for Digitalk and you having to raise awareness on such a very important issue. Thank you so much. This is CRVS is usually only considered from the statistics point of view, but it's about identity, it's about access, it's about national development. So it's a very important issue, and thank you so much for Digitalk putting spotlight on the issue. Of
course, the pleasure is ours. We had we had earlier on Robert, who painted a picture of the importance really, and a light came on in my mind of how really you can't do anything, especially in planning, without having vital statistics. But before we even delve into that conversation, if someone is hearing about this incubator advocacy, Global Health Advocacy Incubator, what does that mean?
Global Health Advocacy Incubator is a global NGO that works in more than 43 countries around the world, and our primary focus is on helping, being a part and parcel of the health system strengthening. So work with civil society organizations and government to identify areas where there are gaps, maybe in a particular health system, and then collaboratively identify how we can come up with systems and strategies to mitigate the impact of the policy gaps, for instance. So then afterwards we work to provide technical assistance such that governments can develop organically these policies which are homegrown, apply to their respective situations, and can be sustainable, because if they have developed them, they are part of them. We've simply just come in to identify and through civil society raise awareness on some of these areas, then government actually takes up and creates policies and regulations which then provide a working environment to make health systems stronger.
Yeah, that's great. How do you bridge these policy gaps? Do you have themes? For example, are you looking at human rights? Are you looking at health? Do you have themes that you say, we based on this theme to advocate for policies that are in line with that vision? If, for example, you like, you are into health, do you advocate for policy around health alone? How do you, what are your themes, or what is your niche really?
Oh, thank you, Matthew. If I was to use a few words to identify the niche for GHAI, it is in incubation. This basically means that we identify an area where there's a great public health challenge. Take, for instance, we are in drowning prevention, where there's a number of Ugandans who are dying each year through an unknown issue, previously unknown or under-prioritized issue. We've been and still are in road safety, where still also a number of Ugandans are dying due to unintentional injury and death. So when it comes to data for health, this is an area where statistics play a very big part in governance. And then now we have a challenge, as Robert has mentioned earlier, that there's quite a bit of statistical gaps in either in challenges of collecting, tools for collection, and so on. But it all boils down to, do we have policy prioritization of the issues? Does government identify and know that these are areas where once we all collectively focus on, it can result in actual reduction of unintentional death and injury, or a reduction in deaths, for instance. So to answer your question, our niche area is in providing technical assistance to governments and CSOs, so that collaboratively we can have policies which can in turn save lives.
Wow, thank you. You've been in operation for the last 10 years. Can you track impact to say, for the last 10 years, these are some of the fruits that we have as an incubator?
Okay, I'll start with here in Uganda. In the road safety space, Now, when we had highlighted that a number of Ugandans were dying annually due to issues around road crashes. Now, one of the things that came out was that police was having a challenge implementing the law. So there needed to have been adjustments and updates in the regulations surrounding management of road safety.
Yes.
Then when it came to budget provision for the Ministry of Works to manage the road safety initiatives, this was at the start around 600 million per year.
Yes, sir.
Now, once regulations were passed through the 2001 Road Safety Act and then regulations which followed, now what you have is that there's an increase in appreciation for road safety infrastructure around roads. So now when road constructions are being done, now you find that pavements for pedestrians are taken into account.
Yes.
Islands for pedestrians as they are crossing a busy road where they can stand in the middle as they wait to cross the other section are being integrated. So a human design element was put in place because the regulations took into account the human pedestrian element.
Wow.
So now once these policies were then put in place, then it came to other aspects of the road safety, because road crashes, for instance, even before even you talk about road crashes, many were saying road accidents, meaning that it was an act of God. Road accidents are not an act of God. It is because of human behavioral, attitudinal issues. You go drinking and expect to reach home driving drunk safely.
Yeah.
That's impossible. You will crash.
Exactly.
There's a higher possibility of you crashing when you're intoxicated. Judgment is reduced. So there's a component of behavioral adjustment, and this also included media advocacy.
Yeah.
So once the media were trained through CSOs who GHI came up to provide technical assistance for media to understand what kind of issues they should be focusing on as far as road safety is concerned, then they started reporting on stories properly.
Okay.
And by properly, it feels subjective, but this means that journalists were no longer reporting issues of number of accidents or who died in an accident, but rather what was the cause of this crash.
Yeah.
And once these were starting to happen, then it wasn't just a matter of because a prominent person dies in a car crash, then you have a media story. It was now even the previously unknown Ugandans who were dying on the roads who were still being published. The number of children who were dying on their roads needlessly near their school because of no speed limits. So speed limits was now integrated through the road safety regulations, which are now come up. So now issues of seatbelt use, helmets, and several other initiatives, which were because policy was put in place and regulations to implement them, now police were able to come up and then systematically implement and act on them.
Wow.
Now you have systems being put in place without external funding being added because government has appreciated the priority need.
Yeah.
And when priority is appreciated and how important it is to escalate its importance, then you've got budgetary spend.
Yeah.
Now this came from raising the budget from 600 million annually for road safety initiatives to 5 billion, just over 5 billion. And currently in this financial year, 9 billion was attached to road safety initiatives. So this is where GHI comes in, and that is in Uganda. In other countries, like for instance in Vietnam, there was a very large challenge of drowning, and the country like Uganda is Vietnam and Bangladesh. These are countries which have very many water bodies, suffer consistently flooding due to either climate or other factors, but mostly because they have water bodies in country, just like Uganda. And as a result, you have many deaths happening, and there was not enough prioritization put in place. Like, for instance, it's little, when women go out to work, as the primary caregiver, women tend to have children on top of their work. So what happens if you're in a waterborne area and you leave children in the house unattended to, and you go off because you need to feed them? Then what would happen is that either when they're going from home to school, along the way they could drown, or they drown at home, either in buckets, in the unattended water manholes or pits, which have now been filled up with water, and then you have drowning take place.
Yes.
Now the woman takes the shame. So now if you don't have policy which comes up and say, as a community, let's take constructive responsibility and provide health care or childcare centers to help make sure that these women have a cushion. These are initiatives which have been implemented in Vietnam and Bangladesh through raising awareness, and that is where we come in.
I can see, it shows me how the small acts that you're doing can actually propagate a bigger vision, because I see it from a perspective of you're doing something here, but in the long run, the effects are recurring to the time when policies actually changed. Someone will not definitively pick on the action, but it's like how they say the flapping of a butterfly can cause in Uganda can cause a tornado in the USA. I can see how you're doing work. I'm still with Charles Onyum Okao, who is the media coordinator at the Global Health Advocacy Incubator program. So how do you come through the civil registration and vital statistics in Uganda project with HEPS Uganda? How do you come about? How do you enter this particular issue?
Okay. Like I've mentioned before, our model is to work with government and CSOs. Now, HEPS is an organization that is working in different programs, but one of the key programs that they're working with and how we come in is in the data for health.
Okay.
Now, in the data for health initiative, they're working to raise awareness on the values of CRVS, as Robert has aptly shared, but also at the same time through initiatives such as the investment case and raising awareness on where there are systemic challenges. Then one of the solutions to some of these challenges would be in policy enhancement. So you find that there is an existing policy on ensuring that Ugandans are registered continuously, timely, and mandated. However, due to one issue or the other, which are usually policy-based or budgeting or resource issues, then you find that there needs to be some strengthening somewhere. Now, GHI comes in to provide technical assistance on how the CSO can interact with different stakeholders to raise awareness at different stakeholder levels, such that the issue is properly understood as a foundation for major government decisions. So this is how we now come in. And then where there's a question on how can we do this? How can we identify the gaps? How can we start the process sustainably? Then GHI comes to provide the technical assistance to guide on leveraging on our experience working in different countries. Then we can showcase how this has been done in other countries, but more importantly, how we can fashion this to work for Uganda.
Okay, for the case of HEPS, what kind of technical support did you offer them? If you were to say, did you advise, were you soliciting for, I don't know, what were you exactly, what kind of technical support were you offering?
Okay. Now, to begin with, we don't come in with a problem which is not existing. So HEPS identified that they're currently trying to increase on data, on the data use for decision making. Now, one of the challenges they initially faced was on how can we make sure that the right stakeholders are involved as early in the process as possible, and then do what we call a legal review. Because at the end of the day, it all boils down to what is the law. So the law mandated continuous registration and mandated it for every Ugandan. And this is also enshrined in Uganda's aspirations as a signatory to the SDGs to make sure that by 2030 all Ugandans are registered. However, there are some gaps.
Yes.
Now, we came in to support the legal review to identify areas where there were gaps in the legal system, where either some aspects weren't clear or needed to be put categorically clear, and then that's where we came in. Then two, there wasn't, I would say, proper appreciation of the issues, and rather the focus, especially in the media, was on the political aspects of the national IDs. Now, national IDs are only one aspect of the civil registration and vital statistics process. However, in Uganda, when we came in, the focus was largely on national IDs this, national IDs that, and so on. So now we came in to provide the technical assistance in supporting journalists understand the essential issues around CRVS, so that they appreciate that it's not about politicking national IDs, but rather appreciating that that is only one part of the puzzle.
Yes, yes, I get you.
And then also now providing support in how to work with different stakeholders such that you have complete buy-in. Because key to every GHI approach is sustainability. If you don't have sustainability, then if we pulled out, there would be collapse. So we transfer knowledge
Of how you can actually
of how to sustain it, how to begin it, such that the CSO continues even after we've pulled out.
So do you, I saw the word incubator, and do you work with young innovators or CSOs that are just starting off? What is the criteria? But also, before we even look at the finances, how has it been working with Ugandan CSOs and innovators in this country? How has the process been for you?
Okay. You see, when it comes to incubate and the term incubator, it is quite common to associate it with entrepreneurship and the innovation space. What seems to not come out clearly is that being able to be able to be a do-it-yourselfer is only one aspect of the incubation. There is also the thought process, knowledge management, and knowledge transfer process. Now, when it comes to GHAI, it's about the knowledge transfer, the technical human resource aspects of it. So our product is largely intangible, but it has tangible results when done well.
Okay.
So when you ask, we're working with youth, young enterprises and the like, yes and no.
Okay.
Yes, in the sense that we work with the CSOs, some of which may be budding enterprises. We look for the passion in them and the will and the desire for them to actually have lasting change which benefits humanity. Now, at the heart of it, when you look at the CRVS space, for instance, and then you see that out of the 45 million Ugandans, currently about 9.8% have managed to get registration before 1 year. And then an additional 10.3% managed to get registrations for their birth certificates below 5 years, which according to the census gives about 11.4% of Ugandans who have birth certificates. Now, when you come now to the incubation aspect of it, how many organizations appreciate statistics? Math is not everyone's favorite. And as soon as you start mentioning math the way I have just done, we start to lose people. So this basically means that if we get an organization to appreciate that the data is what governs decision making, it's at the heart of the governance process, then that is one part of the step towards coming up with sustainable solutions.
Okay.
Then once they start to understand that data is at the heart of even today's world, if you, I remember you spoke about GDP and so on. Now, how can you know about GDP if you don't have data?
Exactly.
How can you know about the number of Ugandans who are who are disproportionately affected by accessibility issues if you don't have data? So at the heart of it is empowering civil society organizations and government to appreciate the values of this data. Where we come in is to build capacity to appreciate where focus needs to be taken into account, and to build capacity to appreciate which priorities need to be aligned with government developmental agenda. So that at the heart of it, when you have political misdirection, then we strengthen CSOs to see past the misdirection. That is where we come in.
To see past the politics, and Uganda has a lot of politics. We politicize literally everything.
Not Uganda alone.
Yeah, but there's how Uganda is actually really different, and because everything, we are skeptic about everything. Let me come to the financing. Do you finance these people directly? Do you give them financial support? Even also, how do you secure funding as an organization that has aided your impact and work?
Okay, thank you. Now, as mentioned before, at the heart of our work is sustainability. And from the recent pullout of one of Uganda's biggest funders, we have seen what happens when you rely heavily on funding.
Exactly.
Donor funding is not a sustainable model. Now, ours is that Uganda is, for lack of a better word, wealthy. We are not called the Pearl of Africa for a bad reason.
Yeah.
We've got a wealth of knowledge, a wealth of human resource, a wealth of different resources, and government collects quite a good amount of money annually. The challenge is that at different steps of the decision-making tree, you have different interests and different levels of prioritization of issues.
Yes.
So when it comes to GHI work, we do not provide funding per se. Now, you can be given, say, 1 billion shillings to achieve some project outcomes, but if sustainability is not at the heart of it, you may finish it and need an additional 1 billion shillings. Now, instead, if you're shown how to make sure that you use this 1 billion, which you already have, but you wanted an additional 1 billion, productively in areas which will matter to you. And then that's how we come in. So Uganda has financing. Like I gave the example of what has happened in road safety. Initially, Uganda was apportioning 600 million.
Yes.
But today, in this financial year, it's over 9 billion.
9 billion, yeah.
This is not donor funding. This is provided for by government of Uganda.
Yes.
So did GHI give it? No. Government of Uganda provided that funding. So what's important and comes strongly is that when it comes to the policy makers, the general public, and you, the media, there's very many health system issues which are around, such as the case of the CRVS issues that Robert raised. However, to get them to be mitigated, there is need to prioritize under-resourced agencies so that they can be able to do their work better. How can this happen? If you have challenges in the legislation, you don't have a legal provision, legal mandate. For instance, like how should NERA carry out registration of a birth, for example, from beginning to end? There are issues of consideration like accessibility of that service at the heart of the matter. If you have we have 149 districts in Uganda, but only 114 of operational offices for NERA, meaning that there's a number of offices still missing countrywide. But even when you have, and currently NERA is has sought financing to support an additional 24, so that gap can be reduced. But now, even when these offices are located in the different districts, you find that they are located at the district headquarters or near the district headquarters.
Exactly,
What happens to people at the farthest end of that district?
They have to come.
On average, it means that they may move more than 70 to 100 kilometers to access the service.
Yeah, that's a long distance, really.
A very long distance. So now, where we come in is that can the policymakers prioritize this higher up in the agenda? Because like when we talk about underfunding in health, then what is the basis for the underfunding? It's because we don't know how many Ugandans are in a specific area. We may know we have 45 million Ugandans, but do we know how many Ugandans are living in one specific area? So that not in Kampala, countrywide.
Okay, yeah, I'm
because
I'm giving an example of a designation.
And giving the example of Kampala, for instance, we talk about up to 5 or 5+ million in Kampala by day.
Yes.
By night, where do these live? So if we do not have real-time data about where Ugandans are staying,
so are you saying
how
from
can you
the
plan
lowest point, village, parish, you want to know all those numbers?
No, we don't necessarily need to know all those numbers as GHI, but as government, government needs to know how many are living where, especially how many are born where, which area, which district, which village, and how many have died where, so that you can easily have a real-time moving database. Then you can now plan. Because if you do not know how many Ugandans have been born in a specific area and are living there, then how can you apportion resources for that hospital?
Yeah, I get
How can you give enough drugs which will cater for the needs in that area?
For me, I will bring in PDM. How will, because you are saying 100 million per parish, if a parish has 3 million people, another one has 4,000 people, and all of them are receiving 100 million, can that be practical according to government? So, but let's continue. That was just my own analysis.
So, once we appreciate that, then it starts to paint a clearer picture of the needs and the gaps.
Okay. What is the roadmap? In fact, you've not hinted on where you secure funding from as the incubator. Just a minute.
Yes. Now, when it comes to financing, Now, GHI with its model is only providing technical assistance, so it is not giving money.
Yes.
So now by providing the technical assistance, then we cannot say that we are getting money and giving money. However, to answer your question more directly, GHI from its inception first initially started as an organization which was raising awareness into the effects of tobacco, especially amongst youth and children.
Yes, sir.
So that is where the organization began from, through funding from Bloomberg Philanthropies, which is world renowned for supporting health initiatives. And hence that is why we have a very strong health system strengthening focus. So where we get the financing from is through our different partners, but primarily through Bloomberg Philanthropies to run that aspect.
Thank you so much. Coming to the end of this conversation, I am with Charles Onyum, who is the media coordinator at the Global Health Advocacy Incubator. As we conclude, what are some of the future plans? How are you doing it here in Uganda? What are some of the projects globally? But also some of the things that you feel you also want to hit about.
Okay. When it comes to plans globally, we have to take it into Uganda's context. Uganda is a signatory to the UN and as such has been working towards the SDGs attainment by 2030. We have about 5 years left. However, many areas, including civil registration and vital statistics, remain challenged due to one reason or another, but persistently it is largely because of the systemic issues. Now, the roadmap would be in the direction of appreciating that if we have the 11.4% who are duly registered as having birth certificates, let's start small. Let's try and work on making sure that registration by birth happens continuously, such that we can even have social protection for vulnerable groups. As a child who is not registered, it means it's as good as remaining invisible to the government. The government cannot provide social welfare for this child. The government cannot plan for education services. And this child cannot even be protected from early marriage. Because how can you know the child is underage if you don't know when the child was born?
Exactly.
So when it comes to the roadmap, let's try and see, can we have accessibility of these services, especially in areas which, for lack of a better word, as most people always say, rural areas, and they don't have this access. So it would be looking at, can we encourage, one, the viewers to do their initially to register such that they can have the birth certificates, but without placing the burden on the viewers. Let us have the viewers come to their political leaders and now start asking the questions that matter. Do you have access to these CRVS offices or services, and how can you access them? And why isn't your political leader discussing some of these issues? And at the end of the day, can we demand for prioritization such that when it comes to CRVS at the national level, we have proper discussions? Because if we're not discussing it, then we cannot be finding solutions to some of the systemic issues that surround it.
Thank you so much, Mr. Onyum. Just your parting shot, and we'll call it a morning.
I believe that it is just the beginning, Let's keep the conversation going.
Yes, sir.
11.4% of the population who have birth certificates is too low. Let us continue to make sure that this discussion continues on. We demand a strong effort towards prioritization of this very important decision-making aspect of government, and then we make sure that every Ugandan deserves to be counted.
Okay.
Thank you.
Thank you, Mr. Charles Onyum, and thank you to our viewer who has been watching us from the time we started up to this moment. There's a lot of knowledge and things that have been shared this morning. I hope you get to start to implement some of the recommendations that have been made by the panelists I've had this morning. We've been talking about the vital statistics in this country, and of course we are interpreting them and trying to paint a picture why this is important. And my key takeaway is that we need birth certificates. Please stop getting the birth certificates at 17, 18, 20. Some are even getting them at 30. No, it's always good if you do what they told you. Register your child as soon as possible. Register death as soon as possible, because this will help you. Do not just do things from a reactionary point of view. My name is Edgar Matthew Karuhanga. We shall see you again tomorrow at exactly 8 a.m. We'll be here having a conversation with Uganda. It will be a Wednesday. And of course, Happy New Month to everybody who's tuning in. It's a brand new month. We are into the month of April. Today is the first day of April 2025. Enjoy your new month. And from the entire team, God bless you and good morning, Uganda.
The Alternative Dig Talk. Real issues, real talk.